So this is a for-profit business. Neture is for-profit.
Right, it is.
But profit is not all of what it's about. It has like community engagement and empowerment involved.
So when we first started, Neture was supposed to be a nonprofit. And the reason why was because we felt that it served a social mission, which is connecting people to services, broadband and other services. But then, as we started to look at the mechanisms of funding it and getting involved in growing it throughout, again, the Bronx, New York City, and the United States, we realized that there aren't many mechanisms in place today to support businesses of this nature. So we figured, okay, well, let's make it a for-profit, but we'll still have a social mission. So our process, our thought process, our goals of connecting the disconnected have not changed. We've just realized that we've had to change it to a for-profit business so we can grow it faster, but at the same time we're not limited by the funding that's typically available through foundations, government, so on and so forth. Oddly enough, our first major investment, if you want to call it that, is actually from government. So we do want to work with governments. We think Neture is an opportunity to not just connect the disconnected, but also to improve connections between government, service agencies, and the disconnected. So if you're thinking about a community, for instance, in the South Bronx where we're first going, there's deserts. Deserts in healthcare, deserts in food services. And what I mean by deserts, I mean there's areas where food services are not as good. There's not as many markets, not as many food markets. The density of the South Bronx makes it difficult to look at all the different health issues, right? So you think about the different roadways that are in the South Bronx, you think about the train stations that are in the South Bronx and different train systems. There's always been a conversation about, okay, what impact has all the different roadways had on the asthma that's existing in the South Bronx, right? All right, so we have a persistent asthma issue, we have a persistent obesity issue, we have a persistent heart disease issue in the South Bronx. What happens if you provide this mechanism to provide free internet access in the public spaces of all of the South Bronx? Then you say, okay, well, we'll give the people in those communities the opportunity to digitally connect to the hospital system, to say, to connect with a particular issue that they're having at the particular moment. It's not restricted by the whether you're paying for the service or not. It is a system that's embedded, that you're providing to the community as a way to connect those families to those services. That does not exist today. There are free Wi-Fi systems throughout the city and throughout the United States, but they're typically provided by either they're for a retail space or they're provided by a company that has a firewall that says, look, only way you can access this is if you're paying for our services. There's all these different restrictions. But what if there's a system that's created just for the purposes of providing the connection? So we see Neture as not just a solution for the families, but also a solution for those systems that are in place to ensure that the families are getting the types of services that the city and the state and the federal government are funding anyway. So it creates a much more efficient delivery system between the families and the service providers. So it's a lot to it, but it's all simplified by the fact that all we're doing is providing the platform, which is broadband, and the software, which is our resources platform, to connect people to the services. And that's it. It's a simple system, but it solves a bunch of different problems.